1 in 12 Canadians lives with rare disease. Many others are at risk but remain unaware. Today we learn more about Fabry disease, a rare genetic condition which, left undiagnosed or untreated, raises risk of heart attack, stroke, or kidney failure.
Fabry disease affects more than 400 Canadians. It's a disease that runs in families. It's a disease that's on DNA, so we call it a genetic disease. It's important to understand about Fabry disease because most patients with Fabry disease may take up to 10 years to get a diagnosis. And there are treatments available that can change the course of the disease and reduce the chance of complications. Males with Fabry disease will typically live into their 50s and women into their 60s.
Mandie was fortunate to be diagnosed at birth.
I was tested shortly after birth with a skin biopsy. My grandfather was one of the first people tested in and confirmed in Saskatchewan, so it was a known thing in my family. So my health today is, I think it's a mixed bag. Some days I feel really great and that leads me to think that I'm doing really well. But the reality is I face kidney issues constantly and I face cardiac issues.
Fabry disease can lead to things like stroke, heart disease and heart failure, kidney disease and kidney failure. Some patients will experience a sensation of burning pain in the hands and feet.
Mandie's mother, herself, and her 3 daughters all have Fabry disease. All experience burning hands.
And it feels like when you are outside in like minus 20 and your hands get really, really cold, and then you come inside and you put them in warm water and it just feels like that ache and that burn and pins and needles.
Dr. Khan stresses the need for early diagnosis and treatment.
If you are concerned about whether you have Fabry disease, you should speak to your healthcare provider. With the treatments available, we are finding better outcomes. And that's one of the main reasons why it's important to raise awareness about Fabry disease so that we improve our ability to find Fabry disease earlier in people, treat it earlier, and try to get better outcomes.
Fabry disease affects all generations. Mandie's grandfather had Fabry disease, which passed to her mother, then herself, and then to her 3 daughters.
My mom is also confirmed with having Fabry's, and then my 3 daughters were also diagnosed with Fabry disease. It impacted my family life. We kind of isolated a little bit. We didn't really talk about our illness, and sometimes people assume that you're making it up because you don't look sick. It was kind of lonely sometimes, and it was isolating.
People living with rare genetic disorders have an additional burden when it comes to having their own children.
In regards to having a family and a rare genetic disease, for myself, it didn't really impact my desire to have children and be a mom. It used to be considered a carrier disease, and so females would exhibit symptoms but maybe not be really as infected or affected as the males. And so for me, I just kind of thought I would always have girls. And so it might be a 50-50 chance. It is a heavy burden because then for me, like I'm looking at all my children going through the same things that I'm going through. And it's heavy because you just want to help them and you want to fix it and you want to solve it for them because they're your kids. But the reality is we don't get to live like that.
Matt Locke was diagnosed with Fabry disease at 34 after his mother experienced renal failure and passed away when she was 57.
The following spring, we were at her cemetery, and that was the day my brother complained about burning hands and burning feet and not feeling like himself. The following day, he went to M.A.G.I.C, and the following day after that, which was a Sunday, he was on dialysis with 5% kidney function.
Matt's entire family was called into the doctor's office.
My brother, my sister, and I, the 3 of us were diagnosed with Fabry disease. So it was a complete shock. For the last few years, my main symptom besides kidney failure, I have 8% kidney function, is nerve pain. I have chronic nerve pain and it's throughout all my limbs, But it's just something that I stay positive about and do what I need to do to, take the right meds and stay positive and keep working. I'm finding out as a family that, this is something that is hereditary. My brother and my sister and I all don't have kids due to this, and it was impacted as far as, what our future, holds for us.
Matt's life remains full. He has his own painting company, and he continues to raise awareness for Fabry disease.
As long as I stay positive, I'm just going to keep doing what I do, such as golf in between infusions and work. I go snowboarding, I walk the dogs with my wife, and I do whatever I can do when I can do it. I just stay as positive as I possibly can.
Many patients with Fabry disease have asked, how does COVID affect their health and visits? Virtual visits are the preferred method to do follow-up visits with patients. I also use those visits, which many people have found convenient because they don't have to travel. In many cases, we can coordinate a follow-up visit where we can ask certain questions and find out if things are stable. We can order heart ultrasounds. We can order blood work and urine tests to make sure the patient is stable and they can get their treatment continued.
Due to COVID, things have changed as far as doctor's appointments and that go. Fortunately for me, a lot of them have been through Zoom.
Imagine having to be at the hospital for tests and procedures during COVID. How would that feel? Then imagine the same situation for many of your family members. That's the reality for Fabry families.
It is a little nerve-wracking due to knowing how many patients and guests are in and out of a hospital. But, I make sure I wear my mask and I sanitize, and I'm trying to just get in and out.
The anxiety around COVID is overwhelming, and it's extremely heavy to deal with for me and for my children, trying to mitigate their healthcare as well and help them walk through a historic time, and the anxiety and panic around that is too much.
COVID and related isolation may leave Fabry patients feeling even more alone. Mandie shares an important message.
The thing I want other Fabry people to know is that you're not alone. Don't isolate yourself. There's more of us out here. We're pretty awesome. I think we have a really great community, and if you're feeling alone, then please just reach out to the Canadian Fabry Association and they'll put you in touch with somebody, maybe me, and we can just walk this journey together. We're just better together.
To learn more about Fabry disease, please speak with your healthcare provider or visit the Canadian Fabry Association at the website below. fabrycanada.com